There is an insidious disease eating away at our country.
When the most advanced economy in the world can't guarantee health care for all.
Just repeal Obamacare.
A devastating blow to Republicans.
Have that coverage to make sure they don't die.
Preventing cuts.
It is the single biggest driver of our debt.
Truly is a tapeworm on the economic system.
The left and the right, don't do this to us!
We must do something about it before it is too late.
I thought I was having a stroke or something. The pain was so horrible in my head. I almost started crying, and I told my husband, I said, I don't know what this is, but I've got to go to the hospital. And then we got that letter later, like about 2 months later, wasn't it, Dave? Mm-hmm. It said our coverage was denied. The bill was well over $11,000. It's been difficult. It's been very difficult.
I'm 68 years old. I was a police officer, and I was in the United States Navy. And when I walked in there, the pharmacist told me, this is not covered by any insurance. And I said, well, how much is it? And she said, it's $500. And I said, God. I said, what are these pills made of gold? I almost ended up in the street. I had to go bankrupt at one time. Well, the choices were either I bought those drugs that I needed to myself, otherwise I would have been dead. I did things I never thought I would have to do. And you never think about it. You never think you'd go from here to here. And when you're down here, you say to yourself, what happened when I used to be up here? How did I get down here? People don't think about it, and people really should.
I started with medical problems. Doctors wouldn't believe me. So I was with that misdiagnosis for about 3-4 years. It turned out to be a meningioma tumor, and so it was right here attached to my eye. My 401k helped me live for about a year or less than a year. It was a struggle. It was a struggle until finally I lost my place, my home. And I became homeless, and I didn't have my own place, and I had to sleep in a minivan. And so all those things, it's like, look at me. I've always had a place to live. I have a degree, I have experience. What am I doing out here on the streets?
I honestly believe the ridiculously high cost of our broken healthcare system poses a graver threat to our great nation than any foreign enemy.
There is no denying that we have some of the greatest doctors, nurses, hospitals, and innovative technologies and treatments in the world. But it doesn't matter how great they are if they remain out of reach for most Americans. We must find ways to protect our health without destroying our financial stability.
The system is not set up for success, and we definitely need to do something about it.
We need to stop fixing things along the edges.
We can improve care for the seniors, and we can help address the cost crisis.
It is the only way we can preserve the way of life that we hold so dear in America. Two words define West Health's strategy for building a sustainable future for healthcare in America: bold action. It's been a year of historic firsts for West Health. We convened the first national summit to drive down healthcare costs. We brought together prominent individuals who all validated our critical three-point platform.
HCIDC was putting a stake in the ground, and we're seeing traction at every level in Washington and through the surveys that we do across the country.
We will take real legislative action to negotiate down the price of prescription drugs that is burdening seniors and families across America.
For the first time, West Health shaped the conversation around the midterm elections.
We found that healthcare was the #1 issue on the minds of Americans.
Our surveys amplified the voices of ordinary Americans struggling to safeguard their family's health without going bankrupt.
Politicians are failing to advance bold solutions, and that's why we all need to engage and start holding ourselves and our elected officials more accountable.
For the first time, we launched our We Stand With Seniors campaign. We persuaded our state's next governor to prioritize a master plan for aging.
It's high time we do all of that, and I want you to know you're going to have a champion.
As a member of the California Commission on Aging, we intend to hold him accountable to that.
This sends a powerful message to the rest of the country that California and West Health are prepared to lead the way. And we didn't stop there.
The accreditation program is having impact today. There are 20 new hospitals that have been accredited to have geriatric emergency departments.
It has made possible better care for seniors to happen today instead of happening a decade from now. And that's an amazing process.
This idea of the GED has great merit in reducing the cost of care and improving outcomes. The other thing that's truly exciting is that we will be the first level 1 accredited GED in the state of California.
We have seen over 900 seniors and 8,500 visits. We are excited at the opportunity of collaborating with PACE and providing much-needed services to North County.
PACE stands for Program of All-Inclusive Care for the Elderly. And we have this opportunity to really be innovative, and we're going to be the first PACE program in California to have a dental center embedded into the PACE program. It's really exciting.
The Gary and Mary West Foundation also took part in launching a one-of-a-kind, market-driven, nonprofit generic drug company called Civica RX, which has the goal to lower the price of prescription drugs for patients. Finally, a true testament to Gary and Mary's commitment to our mission is their recent gift of more than $187 million to the West Health Endowment, so that our work can continue into perpetuity. Bold action is part of the DNA and entrepreneurial spirit of Gary and Mary, who are the visionaries behind our mission of lowering healthcare costs and enabling successful aging.
We can't do what we do but for the team that we've assembled here. It's rare, it's unique, it's very powerful.
I would like to acknowledge and recognize all the hard work that they have done, the sense of urgency that they bring to our mission, but I would also like to challenge them. Let's double down. Let's have twice the number of impact and twice the number of outcomes in 2019.
We are not going to rest until we achieve our mission and Gary and Mary's legacy. It's what seniors and everyone in this country so rightly deserve.
One last thing I want to say is just a huge thanks to the entire Gary and Mary West organization. You probably will never know the difference you're making. You won't know that person who didn't get infected. You won't know that person that didn't fall. But someday you'll look around and realize that things feel better, and that's because of you. And so on behalf of my patients and the 150 million patients that emergency physicians take care of every year, thank you.